Well, there you go. Botox, would you?
No.
Right.
Would you?
Very good question. It would take a lot, take too much. There's now going to be a government-backed register of approved Botox providers, and that's aimed at making the market safer. Let's go to Birmingham now, and we've got Dr. Vik Vijh. Dr. Vijh is a consultant plastic surgeon. Apparently, Doctor, a lot of people in your profession, they object to this register. It's there to make everyone feel safer about it. Do you object to it?
I think there's a problem, Eamon, with this register, in that the IHAS is an independent body. It might be government-backed, but it isn't actually the government. Most of the people who sit on it are actually the big high street clinics that perform Botox. And my problem is, effectively, they're setting out a set of rules with which they comply. Their own marketing says this will bring in more business. It doesn't say this will make it safer for patients. They talk about it bringing them in more business. And that's a concern to me. You can't actually get the guidelines if you go onto the website unless you pay them money. Surely a set of guidelines are about protecting patients. They should be devised by the British Standards Institute and/or the European Standards Institute, and the government should be enforcing them, such that the cowboys who are out there who are doing things incorrectly are actually stopped. This won't stop the cowboys. The IHAS has no teeth with which to do anything other than set out a set of guidelines, hopefully drum up business for themselves, and just, you know, put themselves forward more and more in the public's eye.
Well, I suppose what this does, it makes it all more accessible, more socially acceptable. But what can go wrong? I mean, a lot of people have a fear of injections per se, with the pain with injections, but the Botox itself is seemingly becoming more socially acceptable. When it goes wrong, how often does it go wrong?
I mean, I think this encompasses both Botox and fillers. And the problems are, firstly, that individuals who aren't trained, who don't actually know the anatomy. I mean, these are individuals who've often gone on a weekend course, as opposed to surgeons and dermatologists, etc., who've spent 6 years studying. They go on a weekend course and they decide that they can put Botox in. They'll often put it in the wrong muscle, they'll cause drooping eyelids, double vision. People who use fillers will often put it in incorrectly, put it in the wrong place. I'm frequently in a situation where patients will come into my clinic and say, "This has all gone wrong, can you put it right?" Which is really quite frustrating for doctors, because all the government has to say is, this has to be prescribed by doctors. Really, it should only be done by doctors. Patients can tell if things are right. If you're walking into, you know, a Nuffield hospital or a Spire hospital and you're seeing a surgeon or a consultant dermatologist, you can be pretty sure they know what they're doing. If you're walking into a hairdresser's and somebody's popping in and injecting you, you can be pretty sure they don't.
Yeah, well, that's quite starkly put. I see where you're coming from on that. Are you just in the business, Doctor? Do you put it right, or do you do it?
I mean, I do a little bit of Botox. Obviously, I'm a surgeon, so most of my time is spent operating. I work at the Queen Elizabeth Hospital in Birmingham, but I probably do a little bit of it, and I do a lot of putting it right. So a bit of both, really.
Well, very interesting to hear your views on it all today, Dr. Vijh. Thanks very much indeed for your time. Thank you. We've got to leave it there. Dr. Vik Vijh is a consultant plastic surgeon. We're talking about a Botox register there. I want to now talk about the